In Chapter 8, your textbook talks about considering alternative approaches. So what are alternative approaches, or what are they an alternate to? Alternative medicine is going to be considered an alternate to traditional medicine. We can define alternative medicine as diverse medical and healthcare systems, practices, and products that are not currently considered part of conventional medicine. So our alternative medicine is going to be practices that we use to treat our health problems that aren't part of conventional medicine. So things that you couldn't get if you walked into a standard healthcare facility, right? You're a general practitioner or a mainstream hospital. These are not going to be types of medicine that are practiced there. Alternative medicine is considered alternative because there is a lack of evidence. There's not the same scientific body that supports more traditional methods, such as pharmaceuticals, surgery, and the things that your doctor would prescribe for you. So what are these alternative practices, right? What are they actually? What might I go and receive if I'm seeking alternative medicine? This will be things like traditional Chinese medicine. If you get acupuncture, right? If you go to an acupuncture practitioner, if you go take yoga as a means to improve your health, that's going to be alternative medicine. Chiropractic care, etc., things like that. So by and large, our alternative medicine is going to be found as practices from other cultures and other countries, or practices that just don't have the research evidence yet, things like chiropractic care. They're not really mainstream. They're kind of on the outskirts. Alternative medicine can be used by itself to treat our health problems, or it can be used in conjunction with mainstream medicine, which is going to be referred to as more of complementary medicine. When we refer to all of these practices in general and our different uses for them, we can refer to them as complementary and alternative medicine, or CAM, C-A-M. You might hear me or see over the course of the textbook and in your materials for this chapter the abbreviation CAM, and that's going to apply to all these practices used either as alternative or complementary together. So who uses CAM? Who uses complementary and alternative medicine? This varies by the technique and the culture and country. So in Australia, almost 70% of people report using CAM, as opposed to in the United States, it's just under 40%. So different countries use these techniques at a different rate. This corresponds to a kind of general cultural acceptance and awareness and how mainstream these practices are. So, for example, Australia does have more emphasis on research into these practices, right? As a country, they tend to be accepting of them, and they're looking at whether or not they work. In contrast, the Swedish healthcare service doesn't consider CAM effective, and there's not a lot of research, and it's not nearly as widely practiced. Because a variety of CAM techniques come from other countries, there's the idea that it might be immigrants who are using these practices, right? People who come from countries where they might be more likely to use these type of techniques. It's actually been shown that this isn't true, the idea of people coming over and continuing with their treatments from other countries. Recent immigrants, so it's those who have immigrated in the past few years, are less likely to use complementary and alternative medicine than those who have been in the United States for longer. However, individuals who are of Asian heritage are more likely than other groups to use complementary and alternative medicine. Across different ethnicities, the most common people in the United States who use CAM tend to be female, well-educated, and in higher income brackets. So why do people seek CAM, right? Why are people looking for these alternative treatments? Perhaps unsurprisingly, people who use CAM tend to have worldviews that are compatible with CAM. So people who support the biopsychosocial model and the idea of treating the whole body and the interconnectedness of the mind and the body are more likely than people who stick to a more traditional medical model. It's also been shown that belief in science is, as this would be, incompatible with CAM, right? There's not as much scientific evidence for these type of practices. Those who consider themselves to be very strong believers in science, especially in young men, were less likely to use CAM than others. Also, current health status. So, a lot of people who might not necessarily seek CAM to begin with, right? They have a health problem, maybe they're suffering with chronic pain, and they go the traditional route first. When traditional medicine does not alleviate symptoms and alleviate these health problems, that tends to lead to people turning to CAM, right? If the traditional medicine didn't work for them, that makes them much more likely to seek these alternate methods to try and alleviate their health problems. So, how effective is CAM, right? We talk about how we don't have the same evidence as we do for other things, but how effective is it? By and large, the reason that these practices are considered alternative is because the evidence isn't there the same way it is with traditional medicine. But a lot of this is due to being developed more recently, or the science maybe just not happening yet. So some practices that are considered alternative currently may be considered mainstream in the future. All right, things like chiropractic care. As the evidence builds up, this might move to be more offered through mainstream medicine. One of the reasons that we don't have sufficient evidence for these practices, though, is that a lot of them don't tend to lend themselves to double-blind clinical trials. So in Chapter 2, we talked about how our double-blind study is going to be our gold standard for determining whether something is effective. If I'm trying to test a pill, it's really easy to give someone a placebo pill, right? Just give them a sugar pill to swallow, and they don't know if they're taking it. However, with something like massage, someone knows if they're receiving a massage, right? Or they know if they're practicing yoga and meditation. It doesn't really lend itself to this control group that's equivalent, and we can't have our participants blind to whether or not they're receiving the treatment. It's pretty obvious. So one of the reasons, right, when we say it's alternative medicine, we don't have sufficient evidence, well, let's just test it. Well, it's harder to test than some other things, right? The design for the studies just isn't there. One reason that people tend to view CAM in a negative light when people will have problems with it is that alternative practices can have side effects that are comparable to traditional approaches. So when people go to the doctor and take a pill or they have a surgery, people tend to be well aware that there can be side effects, right? These treatments can have some negative impacts. A lot of people have the belief that if they do alternative medicine, that these side effects are lessened, right? The idea that, well, it can't hurt. And this isn't always true. Things like massage and chiropractic care, right? They can absolutely lead to injuries. Herbal remedies and over-the-counter supplements can have side effects that are very similar to the medicines that just come prescribed from a doctor. So people do have to be very careful about these side effects. And sometimes people don't talk to their practitioners about the alternative medicine that they're taking, right? They don't tell their doctor all their supplements. They don't admit that they're going to see a chiropractor as well. So these side effects are still very real, but people aren't aware of them, and they're not really receiving proper monitoring to make sure that these side effects don't cause problems. There is a body of research suggesting that CAM can be effective, however. There's a number of studies you can read about in your textbook. It presents a list of evidence of all these studies that have been done. But in general, we see for different types of pain and anxiety, things like that, that a number of our alternative methods have been shown in some studies to be effective, right? So we have insufficient evidence. We don't have our gold standard, our body of double-blind clinical trials, but there's some evidence out there. In general, one of the best ways we see these alternative treatments work is when people will use them as integrative medicine. So this is more of our idea of complementary medicine, using these alternative techniques in conjunction with our mainstream techniques. And this can really have a huge benefit because our mainstream techniques, of course, have some serious value as well. So we don't want people to miss out on these benefits from traditional medicine, help from their doctor, in lieu of CAM, but when we see them combined together, right? We can sometimes see the strongest effect when we combine alternative and traditional medicine.